Dr. Timothy Quinn is with us for more on this, family physician and board certified obesity specialist. Is this something, doctor, that you are seeing and hearing among your own patients?
Actually, a lot of reports are coming in, and I've actually heard of one personal patient, but this is no surprise to the scientific community because it's well documented through research that if an individual is living with obesity, and these medications that we noted, they show a 15 to 20% reduction in weight. So if you have a lady that's living with obesity, she's 300 pounds, there's a high probability she has a lot of hormonal imbalances associated with her state of living with obesity. But if she loses that 15 to 20% of her initial body weight, say she's down to 240 from 300 pounds, a lot of those problems are corrected, and now she's more fertile. And that's what's happening in these cases. These women are getting more fertile and they're getting pregnant as they deserve.
Okay, so what if you don't want to get pregnant and you're on this drug to lose weight? What extra precautions are you telling people that they should take?
Well, what's being documented as well is there's been research on animals, not humans, that there can be a problem with absorption of oral contraceptive pills or birth control pills. A lot of it is associated with the delayed gastric emptying, which is the mechanism of action of these medications. So if a lady is out there and she does not want to get pregnant, it's advised to not just rely on oral or pills for birth control, but also other methods such as injections or even different barrier contraceptions to include condoms. That's why, information like this is so important, but this is such an exciting time for so many of my patients out there that have been having fertility issues. And now it's understood that if they can get to a healthier weight, they become more fertile, and now they're able to get those pregnancies that they so much deserve.
But it seems like some experts disagree with what you're saying. They're warning that they shouldn't take this drug to get pregnant, right? Can you help me understand the difference? Like, don't take it to do so?
Right, and that's a good point, Marty. We're not saying that you should take these medicines to get pregnant, but what we are noting is the fact that if an individual is living with obesity, they have a very high probability of having hormonal imbalances that would interfere with their ability to get pregnant. So the messaging that we want to put out there is it's best to get to a healthier weight that will help you become more fertile. Now, if you are using these medications and you're planning to get pregnant, it's noted, documented very well that you should not take the medicine up to 8 weeks before planned pregnancy, because it is also noted that these medicines can be harmful to a fetus if you take them while you're pregnant. And also, if you get pregnant and you're on the medicine, then there is some concern. So the take home that we want everybody to know is, though, if you want to get pregnant and you're having fertility issues and you're a woman that's living with obesity, if you could get to a healthier weight, then that puts you in a much better position so that you can get that pregnancy that you deserve.
Okay, and then once you get to the healthier weight and you're on the drug, then you have to go off the drug because it's risky during pregnancy. First and foremost, talk to your doctor, like yourself, Dr. Timothy Quinn. Thanks for helping us understand this. Just another side effect of this drug.
Hey, what these drugs can't do.
Apparently. All right. Have a good weekend. There is much more ahead here on NewsNation Live. Seizing Trump's expensive